welcome to the Pause It podcast. I am Dr. Sam, and with me, as always, is the very awesome Dr. Robert.
Thanks, Sam. How are you doing today?
Oh, I'm doing really, really well because I'm leaving for vacation in 2 days. So I'm just in a good mood, pumped, packing,
Where are you off to?
New York.
That'll be fun. That's
Yes.
where I'm from. So back to see family, or what you up to?
Yeah. We have a wedding we're going to, kind of like a family reunion that we're doing. And then I grew up there, so we're kind of taking this time. We usually do like a big family trip every year with like my extended family. So my parents, my sister, her kids, my brother, and everybody. And so this year we chose to all just kind of stay in New York. And
Cool.
I'm taking the kids to like some of the places I went to growing up, and then not just like, because every year we go out to Montauk. Actually, I'm wearing the shirt, just getting ready.
Represent?
Yes, exactly. Every year we go out there for a family reunion, kind of in memory of my grandmother, just how it all started. And then and my dad's like one of 7. I have like 21st cousins, and then they all have kids. So there's like, we just like take over. And
You're Irish too, right?
what?
You're Irish too, right?
Yeah,
Okay.
exactly.
This makes more
Big
sense.
Irish Catholic family of loud drinkers and eaters. Like that's pretty much what we do.
They're wonderful people. Those are my
Yeah.
people.
We're lots of fun. I mean, my maiden name was Gallagher, so if it tells you anything.
All I ever think of though when I hear that is that TV show Shameless. I think
Shameless, yeah. No,
it's
my
one of the
cousin
best
actually
shows.
has like a thing of like, why be a Kardashian if you can be a Gallagher or something like that. It's like a t-shirt. But anyway, so yeah, so we're gonna have fun, and then so we'll take them around like Long Island and places that we went growing up, and then I spent a lot of time in the city growing up too. New York City. When I say the city, that's the city I'm talking about. And so we're gonna take them in, like do the Statue of Liberty, the Museum of Natural History. They're gonna get a big kick out of it. I think they're really gonna enjoy it.
Awesome. Well, I'm excited for you guys. It's always a fun time, and New York's such a cool place. Like,
Yeah.
it's very unique. Got
Yeah.
a lot of things going on all the time. So I hope you have a blast. You can tell us
Yeah.
about
Thanks.
next.
Yeah. Oh yeah. It'll be lots of fun.
Cool, cool.
How about you? Anything coming up?
I got a wedding in Pittsburgh, which I mean that's my
Oh,
hometown actually too. So
yeah.
ironically enough,
There you go.
we're both in hometowns this weekend, so that'll be kind of fun. I love the yellow bridges and the rivers and all that stuff, so I'm very excited to spend some time out there.
Oh yeah, yeah. Pittsburgh's a fun city. I can't talk obviously today. I do remember, like, the one thing I remember about Pittsburgh is they put like fries on salads. So any place that does that is cool with me.
Yep, they're what I love their food there.
It's good.
It's a lovely place. So can't wait to see my people again. So I'm very excited.
Oh, good. Yay. Okay. Well, we'll have lots to talk about. And I think we have lots to talk about today because today is going to be one of those things that people always ask about. So we are going to be talking about some controversial things that people do and the choices that they make for their pets, namely declawing cats. That's, I think, the main one. This is a very dangerous topic for sure.
Yeah, this one causes a lot of controversy, even among veterinarians, because
Oh
I
yeah.
think most are shifting a little bit, but there's still some that are like very one-sided on this. So I'll be curious well, it'd be fun to share the opinions of both
Yeah.
sides of this and see what the options are.
Yeah, and I think it's important. Like, I have no interest in demonizing anybody on either side of this, and I think the most important thing that I would say is I don't think there's a place for anybody to get mean about this topic. I don't think there's a place for people to kind of destroy veterinarians' reputations and things like that, because I have seen some pretty awful things surrounding this topic. That being said, I think that again, like, people feel very strongly about it. And so I think it bears discussion, especially because I've had lots of questions about, like, what exactly is it? And should I be declawing my cat and all that kind of stuff. So I guess on the offset, I'm curious to know, what's your opinion on declawing cats? Jump right in.
I'm all what's funny because it's ironic. I grew up with cats that were declawed.
Mhm.
Looking back, I would not have declawed them. And
Mhm.
going, if we had no choice, it would just be, I think, just the front claws
Mhm.
uh, to give them some type of control. Because I guess we can get into the reasons why later on. But yeah, so that's my stance on it. I think it's just trying to keep them intact if you can.
Mhm.
What about you?
Well, I can tell you that coming into veterinary medicine, coming into um, being a doctor, originally, I didn't really kind of have a feeling about it. I was like, oh, people declaw their cats. I guess it's fine. Veterinarians wouldn't be doing it if it was a problem. I
Mhm.
worked at a clinic where they did it pretty routinely, and the doctor there was like, "Oh yeah, as long as you give them good pain meds, like it's no big deal." Then the more time I spent, going to vet school, kind of hearing from people and really learning what it is actually as a procedure, and then truthfully performing them because I have in my life I have declawed because I didn't really like I was learning and there wasn't really ever a surgery that I didn't want to know how to do and
Oh
didn't
yeah.
really want to understand. And some veterinarians that I really respect and that I really love, who I think are good, honest, like wonderful veterinarians, do declaws. I do not do them. I stopped doing them because I am absolutely uncomfortable doing them. And I would say that I definitely like feel like I have been very open-minded about like trying to learn about it, trying to understand it, and even trying to see it from the vantage point of some of the doctors that I really respect that still do it. I can just tell you that when I was in the situation to be performing them, I would dread it. I would be like, oh, I don't, this like beautiful cat. I don't want to do it. I don't feel comfortable. And then I started to realize I don't feel comfortable. And there's clearly something that just doesn't sit right with me with it. And so I have not declawed a cat in years. I don't do them anymore. And I wouldn't. There's probably very few reasons why I would ever declaw a cat. I have revised other people's declaws when they have gone badly. So when they're not healing properly or they've left remnants behind or something like that where there's a problem and it needs to be healed, I have gone in and fixed them. But I don't offer that as a possibility for me.
And I think maybe it's a good place to start and say, or to like follow up with that is what we're actually doing. So like
Hmm.
when a veterinarian removes the nail, they're removing essentially, I know you guys can't probably see this, but like the very edge of your finger. So it's not like that's the anatomy that we're moving. It's the
Yeah.
distal because I don't know what that means.
Yeah.
Very end, essentially the end piece of your finger. So that's what veterinarians are doing. They're removing those things. And I guess I'm curious how throw. I'm curious of your thoughts. Like the one reason I haven't done it in years either because
Yeah.
I be on ER. That's the one benefit of being on ER. Like
You don't even have
you're
to make that decision. There's never an
yeah,
emergency declawing of a cat.
I
Yeah.
can always dodge that bullet. So I am very happy to do so. I probably do something similar to you where like if I see them come in, there's a lot of infections sometimes that develop because of them. So I've seen that every once in a while. But
Hmm.
in California, they're very claw friendly. And that's the
Yeah.
best way to put it.
I would
There's not
say,
a lot.
because aren't there a lot of counties and a lot of cities in California where it's illegal? Like you can't even do it. It's banned, right?
No, I have to check, to be honest with you. I think you're probably right because I know, like, I can't remember the
I'm
last
pretty
time
sure like Los Angeles County, like Berkeley. I mean, like there's like a good handful. And I think San Diego may even be one of them too,
it
for
might be
sure.
because I honestly haven't seen one. I can't remember the last time I've seen a cat that's been declawed. It's been a very
Yeah.
long time.
I'm pretty
Um,
sure either they're looking to ban it or they did ban it in New York. Now where I live in Indiana, it's totally legal. People declaw cats regularly. Um,
and
and
maybe,
I've had, what were you gonna say?
oh no, go ahead. You're good.
Oh no, I was gonna say like I feel like that's a conversation that I have pretty often with kitten owners. Because I do think it's my job to make sure that they understand that cats scratching is a very natural, very normal behavior for cats. And a lot of times, like even after they've been declawed, they'll still do the actions of scratching. So um I think that if you get involved early on and really like look into ways to kind of make their environment optimal, offering them a place that you're okay with them scratching should be part of the equation. And there's plenty of cats that live in beautiful homes with expensive furniture that do not destroy their furniture. So I
Yeah.
don't think it's a foregone conclusion that, oh, well, I have a cat. I'm just going to declaw the cat. You know what I mean?
Well, I think it's looking at the reasons like why people do it in the first place.
Mm-hmm.
The only reason I know of personally is for the reasons you're kind of, talking about. It's they're going to cause damage to my home,
Mm-hmm.
or they're maybe to your children. Like obviously, like my parents' concern when we were younger is our cats had claws, we get scratched up, and that was their concern. So I think those are the big reasons I know. Do you know of any other major reasons why people declaw their cats?
Yeah, I've seen so two of the other big reasons that I've seen are elderly people because their skin is so paper thin that they bleed quite a bit. And so I have definitely had people say like, "Oh, I need to get my cat declawed because I don't want to get scratched up by them." And then people with suppressed immune systems also not wanting to get scratched. Um, the thing that I think is very interesting about that, because I've done quite a bit of reading about it, because I do, especially with situations like this, because I think that it's hard not to, especially coming like listening. So anyone listening to this podcast, I mean, they hear two veterinarians that are like, we don't do them, right? So I think it's very, very hard not to sound biased when I'm talking about it. So I really do try to say, okay, I'm gonna like try to hear what the other side of things is. And I mean, like, and I again like have there's doctors that I really respect that I think are very good doctors that have their patients' best intentions that don't agree. Like they think that they're no big deal. So,
Yeah.
I'm just gonna put out there that there are very reasonable people who declaw cats. I think that in kind of researching it, I was looking up to see if some of those myths about like, oh well, if I don't declaw my cat, they're not going to have a home, or it's better that they're declawed than that they're in a shelter. And actually, in places where declawing is banned, there isn't more like animals relinquished by like if you actually look apples to apples, like there are in some cases I have had people know this anecdotally people have said like, oh no, saw way more declawed cats, like, which I don't know that that's true, because I think when you actually look at the numbers from everything I've read from a little bit more of like a scholarly look at things versus just someone's anecdotal idea,
Sure.
um they actually say like behavioral relinquishing is just as bad with the biting as it is with the scratching, right? So that you
Yeah.
don't end up having more cats in the shelter because they won't declaw them.
Well, I think part of it's when you're taking away their natural defense mechanism, which usually is their claws,
Hmm.
they turn to biting more often.
Hmm.
That's just as bad, if not worse, at least from a veterinary standpoint. Like,
Right.
I'd rather be clawed by a cat, it still sucks. But biting, man, their teeth go so deep and they cause so many infections.
Oh yeah.
Like, I'll take a dog bite almost over a cat bite for that reason, because
Oh,
cat
and
bite,
their teeth are like needles,
oh
like
God, the
hypodermic
horrible.
needles.
Yeah, like I had two texts this week that got bit by cats, and they both had to
Yeah.
go to the ER because of like I started on antibiotics and clean out the wounds, and
Oh yeah.
they didn't do a good job of wrapping the wounds. Honestly, they came back and we rewrapped it for them. But nonetheless, the point is, when you take away one, it's the excuse to like, hey, they're gonna hurt, like they might hurt us, something like that. They're
Hmm.
just gonna use another way to defend themselves afterwards, and I think there's a lot of, I think it's good to look at always the pros and cons of the
Hmm.
situation.
Yeah.
A lot of the cons for me are that, for example, or the stress related with it. Kind of, I think it's similar to what you were talking about with the scratching post. Like, it's how they relieve their stress. It's how they do things. A lot of cats, they're more likely to obstruct. Which, when I say obstruct, urinary obstruct.
Hmm.
That's been tied to being declawed as well. So
Hmm.
for me, that's a big reason to keep them intact with their
Hmm.
claws.
Yeah. Yeah. I think too that you know um people are always worried also. So let's say that they've made that choice before, like they said like, okay, well, we declawed this cat, so now any cat I get subsequently, I have to declaw. That's not true. I've seen plenty of households where people have had either a change of heart or just they adopted a cat that happened to be declawed, but they had other cats with claws and they've been fine. So I mean, I don't think that that's like a foregone conclusion that oh, just because this cat was declawed, my other cat has to be declawed. And I also do think that there's a lot of people who really don't think about it, right? I mean, like, there's people who think about it a lot and have a very strong opinion, but there's other people that are like, I mean, it's a big deal. Veterinarians wouldn't do it if it was bad. And, I think that a lot of times we're not offering people other options.
I think that's a really good point. I think, especially, I would say about maybe even as close to as like a decade ago, it was much more common to declaw cats.
Oh yeah.
Now it's definitely a shift in the field, and I think you were kind enough to get some evidence earlier from some of the national veterinary organizations that we
Mhm.
have that kind of made statements on those things. I'm not sure if it's worth reading them off.
No, I do. I have them. I think it's worth it. I mean, I think it's also kind of good to maybe hear kind
Yeah.
of two different position statements about it. So the AVMA, as I have it here, they have a position statement on, and the AVMA is the American Veterinary Medical Association. So it's like our big medical association. And this is what they say: the AVMA discourages the declawing. They use the actual word as well, which we won't have to worry about, but it's of cats as an electric. Okay, I'm gonna start that again. The AVMA discourages the declawing of cats as an elective procedure and supports non-surgical alternatives to the procedure. The AVMA respects the veterinarian's right to use professional judgment when deciding how best to protect their individual patient's health and welfare. Therefore, it is incumbent upon the veterinarian to counsel the owner on natural scratching behaviors of cats, alternatives to surgery, as well as the details of the procedure itself and the subsequent potential complications. Declawing a cat is a surgical amputation, and if performed with multimodal perioperative pain management, that must be utilized. So basically, what they're saying is that people should be aware of what's happening. So as Robert said, we are taking off, it's called the distal phalanx, but basically it's the tip of the finger. It's not just the nail, it's the actual end of the finger. And it's being basically disarticulated. And there's three different methods of doing that, which we can certainly get into.
Jesus.
Um, and that they should be given proper pain medicine, and people should also be aware of it. But before doing that, and I think where a lot of, I think some veterinarians miss the opportunity to educate and to let people know that, you don't have to declaw your cat. You can cut their nails pretty regularly. You can put caps on their nails. You can teach them to scratch in specific places. There's lots of things that you can do to discourage them from destroying your house. And I think that people should be aware of that. Now, since I did such a great job reading out loud,
You did great.
um, the, trying to read from my phone as we're doing it, but
Uh,
the the American Association of Feline Practitioners. So these are people that basically are solely cat veterinarians. So they have a little bit more of a specific practice. They have their own position statement, which I think is interesting to read.
mhm.
So they say the American Association of Feline Practitioners strongly opposes declawing as an elective procedure. It's the obligation of veterinarians to provide cat owners with alternatives to declawing. If owners are considering declawing, they should be provided with full education about feline declawing. And they put forth points that are the foundation of why they came up with this position. So they said that feline declawing is an ethically controversial procedure, which I think is true. I mean, there's
Yeah.
plenty of people because it's not ever medically necessary, right? So I think and that's actually the next point. Declawing is not a medical necessity or a medically necessary procedure for cats in most instances. And then they say scratching is a normal feline behavior, both inherited and learned. Cat owners should be educated on feline scratching behaviors. Veterinarians should provide behavioral recommendations to allow cats to express these behaviors and reduce those undesirable to the client. And then the next is declawing is an amputation of the third phalanx, which we already talked about, which is the tip of the finger. And it's a veterinarian's obligation to educate cat owners and provide them with alternatives to declawing. Veterinarians should counsel cat owners on alternatives for declawing, such as providing scratching posts and pads, trimming nails, preventing injury to people or household items, considering temporary synthetic nail caps, using synthetic facial pheromones and or diffusers to help relieve stress, and providing appropriate feline environmental enrichment. There are inherent risks and complications with declawing that increase with age, such as acute pain, infection, nerve trauma, as well as long term complications like lameness, behavioral problems, and chronic neuropathic pain.
Yeah. And
And
I think that's a really good summary. That's actually, I didn't think it would be that detailed. That's actually a really nice summary of
yeah, yeah,
all the reasons not to do it, because especially the last, I think, couple of reasons, like the acute and chronic pain
yeah.
component of things, the nerve pain, the behavioral issues. I I don't think sometimes owners understand how big a deal it is for them to be able to scratch things and how it's healthy for them in terms of stress relief. It's kind of like when I go running, it's a healthy thing for me to go do. Healthy for cats to scratch things. You may not like them scratching, but they scratch. But if you
Mhm.
find those alternatives, it's a win-win for both situations.
Yeah. And I think it should also be said that there's plenty of people that are like, I've declawed every cat I've ever had. There's never been a problem.
Yeah.
I mean,
Uh,
so that's true if I guess if you have a cat that um has never had a problem like behaviorally and anything like that after. The hard part is though is about the pain and the chronic pain. I think what some people don't recognize in their cats are like the change in their gait, which I think most people who know anything about how cats move around, one on the ones that have been declawed, a lot of times as they get older, you start to see this like arch in their back, and that is generally attributed to the way that they change their gait um from having their being declawed. And cats are notoriously really good at just like masking pain.
so good. Honestly, that's probably the number
So
one thing I see in ER. Like every owner's like, yeah, they seem fine yesterday. Like I'll have cats with just feeling crappy in general. Like
mhm,
the day before, they was like, yeah, they ate yesterday. It's so weird. And then they came in the next day and they're like not moving. They're like lethargic. And we do blood work and their creatinine, which is one of their kidney values, is like through the roof. And
mhm,
I was like, yeah, I saw them eat yesterday. Like, I don't understand. Like, cats are really good about this because they are prey animals in this environment. They
mhm.
do not want to show that they are sick, because as soon as show you are sick in the real world, you're going to be picked off by something else. So it
Right.
doesn't do the advantage to show that they're sick. So cats are really good about hiding things, especially things
Mhm.
like
Yeah. Yeah, absolutely. So, I mean, I think that that's where ultimately I've kind of come down on this is just like I just feel like it's part of what cats are, and when we make the decision to have a cat, I have such a hard time with removing their parts of their toes. You know what I mean? And I do think it's really important if you are going to do it to make sure that you go to a veterinarian that knows how to do it well, is
yep,
taking care to do it very carefully and surgically, um, and providing really good pain management because it really is I mean, there's no way that it's not painful. It's an amputation. You know what I mean?
100%. I think that's probably one of the most important things. And even, especially if your cat's an outdoor cat,
Oh,
for
well,
God's
don't do
sakes,
it.
yeah, like, for God's sakes, leave them their claws. It's like, that is their weapon of choice, like, that's how they defend themselves.
Yeah.
Um, like, please, God, don't take off their claws for that, so,
Yeah, yeah. And here's the thing. I mean, there are cats that have been declawed that have gotten out and done fine. I mean, cats can still
yeah,
climb trees when they're declawed. They can still hunt when they're declawed. There's a lot of myths out there that cats like can't do these things when they're declawed. That's not true. They absolutely can. They can't do it as well as they could before they were, but they can still do it. Um and I mean, because I had somebody one time that had declawed a cat that just wasn't thriving inside, and they had asked me like, "Well, can I make this cat a barn cat, or will that be cruel?" And I was like, "No, you can make them a barn cat. I mean, as long as you're feeding your barn cats, as long as they're safe and protected. I mean, it's better than euthanizing. You know what I mean?" Um, so I think this cat went and had a like pretty good life as a barn cat after that, and I've known a few people that have had declawed cats that are like, we can't keep them in the house. Like we just can't do it. And, they did okay, but it's not optimal. I wouldn't make the choice and then put them outside. That's for sure.
no, and I guess the devil's advocate, I'll put that out there for you, is what if an owner comes to you and says, "I'm going to have to euthanize this cat because of how they're acting at home, they're scratching up everything, and we've tried scratching, posting things, and, like, would you declaw them then?
Oof. I mean, it's a really hard question because I think that I'd have to like really look at the entire situation. I mean, when you declawing an older cat that's over 8 pounds, that comes with way more complications. It's a much different conversation. Not that again, I still don't do it, but you're talking about a small cat that's like a kitten getting a spay or a neuter, and then having them declawed when they are just a few pounds versus I've seen the complication rates go much much higher over 8 pounds. They take a
Really?
lot longer to recover, and that's a lot harder on them because they're already overweight. You know what I mean? So I don't know. I would really struggle with that. I mean, I don't perform them, so nobody would come to me about it. And somehow in other countries where they're banned, those things don't happen. So you know what I mean? Like, because everything I've read, that when I see a lot of the comments from some of the like major feline contributors that are like the really well-known people who um lecture at a lot of the conferences and stuff like that. These are people like probably two of the ones that I think are the most well-known, ones from Australia and the other ones from England, where they just don't do it. And they're like, these are not arguments that we see. Like people are not constantly like, oh, I have a bleeding disorder, I need to get my cat declawed. Like that's not a they just don't do it and they're fine. You know what I mean?
Oh yeah, I think
So,
I wonder if one day we'll get there as a profession, just essentially moving to a point where it's like it's just not an option anymore.
yeah.
Okay.
I
Go ahead,
do have
Sean.
I do have another then a question that this could be an interesting thought process, but how do you feel about the government getting involved with it? Like how do you feel about them banning it?
I think the government has other things to focus on.
Yeah.
So I think that's just one person's opinion, but I think the veterinary industry is more than capable of making their own decisions. But I think, well, I mean, I think unfortunately, look at this is slightly unrelated, but for us to establish right now, there's a lot of conversations about virtual exams
Right.
and how to establish a client relationship, over without seeing the pet. That's how a
Hmm.
lot of veterinarians are to prescribe medications and give advice. The government's technically involved in that,
Hmm.
right? You go to Congress and fight at Congress for that. So I guess do we have to at some point? Now I'm kind of questioning.
But my thought is like, why? Like, I guess, are we meant to be left with the ability to make the best decisions for our pets or not? I mean, we are the doctors. So I don't know. I'm not a big fan of the government deciding things that they have no idea about. I do think like that is the one part about on the AVMAs, you know what I mean, thing where it's like it really should be left to veterinarians to make that decision. Because I'll be honest with you, I don't even think 10 years from now veterinarians will be doing it. Truthfully, I don't. I think that's the way we're moving. A lot of the younger veterinarians aren't the ones doing it anymore, and a lot of the older ones who are more comfortable with it because they've seen it before the multimodal pain management and after, and they see it as a much more comfortable, much easier, you know what I mean, than what it was, which
Yeah,
I could understand, right? I mean, we have the ability to really control the pain and to do a better job now than was done 10 years ago. So I think that that's maybe where some of that bias comes from, but I'm not really sure that a bunch of bureaucrats should be the one that tells us to do that, but that's my opinion.
behind you on that one because yeah, I know your lane, right? Or stay in your lane. That's what it is.
Exactly, stay in your lane. Well, just because I think we're only a hop and a skip a jump away from like when's the next thing that we maybe know more about that then we're going to be told like, oh no, that you can't do that anymore. You know what I mean? And so I don't know. I struggle with that. And that's not to say that there isn't a place for intervention. I mean, obviously there's animal control, there's, you know what I mean? Like there are laws about animal cruelty that of course should be there. So it's always a bit of a tightrope walk. I don't mean to say that there is no room for government intervention. And certainly I mean, we have a state veterinarian. And if they want to weigh in, I don't really have a problem with that because that's their job, although they usually do more production kind of stuff.
Yeah, so using one of the health food.
Yeah. I mean,
Yeah,
I guess that's a conversation for a whole nother day. State veterinarians and all the other things veterinarians do. We can definitely talk about that a different day.
yeah, that's a long topic in itself. But yeah, I think overall just trying to avoid it decline in general.
Hmm.
And I'll be curious where the field's at in 10 years.
Yeah, me too. And I think really what it comes down to is just educate yourself about it. Look at both sides. Don't decide that you already know the answer until you've looked at it. Understand what the procedure is. Maybe look at some pictures. I mean, I feel like I learned a lot by seeing them done, by performing them and being like, oh, I'm not really comfortable with this. I don't really want to do it anymore. And so I definitely changed my opinion on declawing because of how it was presented to me in the beginning, how I learned it, and then how I felt just personally when I performed them.
And I think that's a really good way of saying it too, because as veterinarians, we appreciate all feedback too. So if you hear this podcast and you're like, I have a different opinion, as long as it's a polite opinion, feel free to share it. We love to
Yeah.
hear it. That way it opens our eyes to other things that we may not know about or other considerations that maybe we haven't seen or heard yet. So by all means, like feel free to send us an email at
Hmm.
podcast@mybalto.com and we're more than happy to bring it up in the next podcast. Because I think it's interesting to hear owners' perspectives because sometimes something happens that we don't see. And
Right.
I also acknowledge that I send owners home with medications all the time, and I just expect their owners to give them. But I know how challenging it is to give a cat a pill
Hmm.
or a dog if they don't want to take it with their medication. So it's easier said than done, and we'd
Right.
love to have your opinions.
Yeah. Well, and I think that's very true. I think that's well said. And I also think like we're reasonable people. I don't think people who declaw their cats are bad people. Like I
I
don't
don't know.
think that. I have friends that declaw their cats. Again, wonderful doctors I respect that still feel that it's okay to declaw. And I suppose if it comes down to it, I'd rather somebody who knows what they're doing and is managing pain do it than somebody who's not. I'm just not comfortable doing it. And I think that I think little by little, the more people understand about it and the more we learn about cat behavior and how to optimize our spaces for them, the less that we'll feel that that's necessarily. At least I hope that that's the case.
Me too. Yeah, I'd be curious. Now I'm gonna look into there's some interesting things about that. But yeah, I agree. 100% agree with you.
Yeah. And I think another day we'll talk about some of the other things that people do. So I guess while we're here, just real quick, I'm just curious. We don't have to get into the whole thing, but like, how do you feel about ear cropping?
I'm so against it just because of the number of ish. It's tough because I always see the worst cases. I always see them when they don't go right. I
Yeah.
never see a dog. There was a dog. Actually, I saw a dog at the beach the other day when I was running, and there was a Doberman with its ears, cropped. It was cute. They looked like they were working great. But I always see the ones in the middle of the night where they're bleeding or they're infected, and it's like they're just as cute with them down as they are up. I'll be
I think
honest
they're
with you.
cuter.
Yeah, it's
Yeah,
cuter. Like,
I'm not a fan. I mean, I guess for me it's just I feel like I see a lot of botched jobs too. And a lot of people get their dogs' ears cropped, like not by
yes,
like they
that's
just go someplace and they give them drugs and they do horrible things without pain meds. And so I have a huge problem with that. I'm not a fan. Again, I don't think it should be banned. I just don't I don't I wouldn't perform it. I wouldn't do it.
yeah, same here. And tail docking, I'm not really sure. That one's a little different for me because
I
we do it
think
with
they do it when they're puppies. I think they do it super, super young. Again, I never learned to do it because I'm not really interested in doing that. I don't really see the point of it. I have to amputate tails because of like medical reasons. And
exactly.
so I mean it's an amputation.
Yeah,
It's different though when they're puppies because you don't it's not the same. It's not as complicated. It's just not the same. Same with dew claws. Like they're like I'll take off. I often will take off the ones that are not articulated, the ones that are just hanging there
yeah, that's
by some
safer.
skin,
Yeah,
especially on the back. That's because honestly, that's like preventative for them like hurting themselves down the line. So
it's
I
all
see the point. The ones that are articulated though, that are like an actual digit amputation, I don't just do that for cosmetic reasons
yeah. No,
ever.
I agree. The ones that are hanging, though, honestly, you're doing me a favor because the number of dew claws that are bleeding, they get torn off when the dog's running through the bushes, and they're halfway off, and I got to take them off at night. Literally happens all the time. So
Yeah.
thank you.
Yeah.
Yes.
Oh, you're welcome. No, those I think are helpful. I can see. I think just for me in general, especially just because what I spend my time doing isn't really cosmetic. Like even when
Yeah.
I do anything with like folds or opening noses, things like that. I mean, those are necessary like to help you breathe or to decrease infection or to save you from pulling off a nail, or you know what I mean? Like that type of stuff. I just did a tail amputation the other day because of a dog. This poor dog just had this mass on its tail that was huge and bleeding and angry, and there's no, you can't heal those. You know, there's no healing those, and it's just months and months and months of mess, or just cleanly remove it. And so that's what we did. But yeah, I'm with you on any of those cosmetic things. It's not for me. Again, I don't
Yeah.
think they're cruel. I don't think they should be banned, but
Just save your money for something else. You'll probably need it for foreign body or the breathing issue or the back issue or
yeah,
all the
or something. Yeah.
chocolate. Who knows?
But how many of those, like the ear ones with the Dobermans, is because of like them not knowing about, you know, like the bleeding disorder or something like that, or is it just a botch job?
Most of them are boss jobs. I haven't had one that was a bleeding sore, but I've had more. And they're all due to the issue that you talked about with. There's one that a veterinarian did, but I'm sure it was just like anything can have an infection.
Any surgery can have complications. Any surgery.
But 3 or 4 from someone who was not a veterinarian doing it. And I was like, stop doing this. Like, for God's sakes, like it's just, you're making it so much worse. And
Yeah.
just you feel bad. So
Yeah, and that's the other thing too. They're just puppies. Like, I don't know. I think they're cute with their ears hanging. So that's my own opinion too.
yeah, I'm
Yeah.
on board that train.
Yeah. Well, anyway, just thought I would plug that right in there at the end. but yeah, if
Plug.
you do have any questions, anybody has any questions about declawing or just any of these controversial things, I mean, we're here to answer them. Again, judgment-free zone. This is just my opinion. This is just Robert's opinion, like 2 veterinarians' opinions, and really comes from like a gut feeling about how these things go.
And obviously we're always right, but if you don't know, I'm just kidding.
Well, that's clear.
No, but we're more than happy to hear your opinions.
Well, this has been the Pause It podcast. I hope we don't get too much nasty hate mail after this.
Thanks, Sam.
No problem. Thanks everyone for listening.